Great. So I thought I'd use my time today to try to untangle this interrelationship between human and animal health, food safety and food security using poultry as a lens. And I wanted to focus on three problems where poultry has a role. So first, I'd like to talk about malnutrition and the role of poultry production in ending child malnutrition. And then I wanted to touch on the health impacts, or EED, environmental enteric dysfunction in children, and poultry keeping has been implicated in this. And then finally, I wanted to explore a little bit some of the wider environmental issues, and specifically AMR in poultry production. But I thought it would be really useful to frame my remarks in a very old concept that's currently having resurgence in the literature, and that's this notion of tame versus wicked problems. And so what is a tame problem? Tame problems are essentially problems where we know science can solve it. We can define the parameters. We have the resources and technical knowledge to effect a solution. Wicked problems, on the other hand, are so unstructured, so complex, we can't adequately define the edges. And the original argument was that science was set up to deal with tame problems, but it wasn't to deal with wicked problems. So in terms of malnutrition, of course, we can't talk about malnutrition without acknowledging the pandemic. And we know that COVID-19 has been swelling the number of households under food stress. I think the World Food Program has quite a frightening statistic that the number of people in LMICs facing acute food insecurity will be around 265 million by the end of this year. Now, a recent estimate published by Lancet noted there was about 6 to 7 million more wasted children, and these are children who weigh less than they should for their height. We don't know the impact on child stunting. Now, child stunting, stunted children suffer from impaired linear growth, they have cognitive deficits, and they also suffer from intestinal disease. Now, I thought I'd show an example, and India is a very good example of this dichotomy between malnutrition and poultry production. So I think more than a third of the 142 million children globally who suffer from stunting live in India. But in 2019, India produced 19 billion eggs, and this was according to the Indian Council on Agricultural Research. And so it strikes me that 44 million children, stunted children, 25 million wasted children, 6 million COVID vulnerable children, 76 nutritionally vulnerable children million versus 19 billion eggs. Eggs are a very low cost source of protein, 1 to 2 to 3 rupees per egg. So why isn't this the solution? Why isn't matching nutritionally vulnerable children to eggs, what we should be going for? And I think there's a lot of reasons that this hasn't happened, and it's really around equity and access. Many of these eggs are bound for external markets. Palatability, children don't traditionally eat eggs, and many states have had programs to try to support egg consumption among nutritionally vulnerable households with kind of mixed success. But I think what's really interesting about this chicken and egg story in India and in other countries is a lack of, I would argue, deep evidence. When you start looking around, there's very, very few studies, high quality studies that have looked at the impact of egg consumption in preventing or ameliorating the specific clinical features of malnutrition, such as stunting. And we know that eggs can have an impact on choline, which is an impact on epigenetic signatures. So the question becomes, can egg consumption during pregnancy help to prevent stunting? So eggs, but this is the other thing, eggs aren't entirely benign. We know there's a range of foodborne risks from Salmonella to Campylobacter, and Theo is going to talk more about this. But we also know that malnourished children often suffer from intestinal enteropathies. And there's an emerging body of literature here that really demonstrates children living in households may be more at risk. And I would encourage you all to read Robin's excellent paper on this. But there's, if we look at the body of literature as a whole, there's been very, very few studies that have linked confirmed cases of EED to the specific pathogens in poultry. So the evidence demonstrating, direct causality is quite low. So here we've got egg consumption as part of the solution, but poultry keeping may also be a driver to EED, which is a key clinical manifestation of child stunting and child malnutrition. But this also brings us to this really wider environmental issue, the impact of poultry production on the environment. And here I'm going to focus on antimicrobial resistance. We know that environmental AMR is increasingly recognized as a major problem, and antibiotic pollution is found in our water supplies. And interestingly, this antibiotic pollution is classified as a class of pollutants referred to as contaminants of emerging concerns, which means they're unable to be removed by current wastewater treatment technology. And I think it's here that poultry production systems and their use of antibiotics, we need to dive down into this and look at this better. And so how do antibiotics get here into our water sources? Well, it's quite simple. It's largely through the poultry litter. And poultry litter, many of you know this, I'm sorry to have to say, but it's usually sawdust or straw. For every 1,000 birds, you need about 82 cubic feet of litter. So what's in this litter? Well, it turns out there's quite a lot. So there's metals, there's arsenic, there's copper, there's iron, selenium, there's zinc, and these are often added to poultry feed to improve weight gain. And we know heavy metals are a big problem in AMR. There's a variety of studies that shown that the level of metals in poultry feed are concentrated at least 2 to 3 times in the litter. And so after the runoff, when this is used as fertilizer, this runoff contains high levels of bacteria, the metals, and the antibiotic residues. And it's really a global problem. I think 90% of the poultry litter, I'm going to use a US one, is used as fertilizer and spread on farmland. And this is kind of an interesting example. The Delmarva Peninsula is home to 523 million chickens. It's part of the poultry belt in the US. And they produce an estimated 42 million cubic feet of litter. And most of this goes around on the surrounding farmland. The Chesapeake Bay is considered one of the most polluted waterways in the US. So how do these issues play out in the global south? We're currently involved in a project which explores antibiotic pollution in the Nairobi River. And the Nairobi River has a kind of, unhappy association with it's the 4th most polluted water river in the world. And I think there was a recent study that found there was over 24 antibiotics. And most of the informal settlements are located on tributaries of the Nairobi River. And there's a large number of people in poultry that live in these environments. But equally, another issue in Nairobi is the number of poultry slaughterhouses. And so, some of the bigger operations actually do have water treatment plants on site, but everybody else really doesn't. So there's a large amount of effluent and waste water from these slaughterhouses that go in local water supplies. So where do all these examples leave us? I think that we've been approaching all of these complex problems from different but equally very unhelpful perspectives. We've spent absolutely decades looking for the silver bullet to solve child stunting, and with very, very little success. And with this lack of success, it means that too often we see child malnutrition as a wicked problem. And I think this is really unhelpful. Child malnutrition at its core is a Tame problem. How can we deliver safe and nutritious food to vulnerable children? And then how do we get them to consume it? So I think it really is a question of matching 19 billion eggs to 76 million children. And I think the poultry sector can play a very big role here as part of the solution. But equally, preventing environmental enteropathies, again, here, I think this is another Tame problem. And this doesn't dispute the scale of the problem, but we can support awareness raising and behavioral change among small scale producers. This isn't an impossible ask. Now, the last one here, AMR, I think we have a different dynamic. I think here we approach AMR and LMIC countries as if it were a tame problem. And, when you read the AMR national action plans, they tend to really focus on overuse, and their solution space is really about building sufficient capacity so we can control it. And I think, as soon as you start unpacking environmental AMR, you realize that this isn't going to work. So I think here we need technological solutions to start to enable us to kind of leapfrog what are our weak regulatory environments. So I guess I'm going to wrap up, and I just wanted to share a few key messages. I think in order to build back better, the evidence base needs to show how the benefits of poultry production can be amplified and the risks ameliorated. And I know that this is a core aim of the Poultry Hub. And the other thing is, of course, enteropathies can be prevented, but we need better research to develop tools and approaches to work with small-scale producers. I think regarding environmental AMR and contaminants of emerging concern, we need a much, much better joined up response to this globally, nationally. The poultry industry is a very large player here, and they need to be part of the solution. And I guess finally, I'd like to say that, we know problems can cascade through systems, and they tend to amplify as they do in intensity and complexity. But I would argue that solutions can also cascade through systems, and they really enhance our ability to unpack these issues. So in short, I think we need wicked solutions to these wicked problems. So thank you very much. I hope that I was on time there.